So with age comes wisdom, or so they say, but also there's some wisdom teeth sometimes involved. When your mouth goes through many changes with your aging. First come the primary deciduous teeth, baby teeth, after the age of 5 or 6 years old, depending from the case to the case. Permanent teeth start to erupt until it's all over, but at the age from 17, 21 and sometimes further, third molars occur. One of the major milestones that usually takes place between the age of 17, 21 and more is between age when we reach some form of maturity, so that's why they were called wisdom teeth. So when they come through correctly, everything is fine. You can use them, they can help you to chew things, to help you digest your food more better, and everything with them is then nice and easy. But if they do not erupt in a proper way, if they have some weird angulation or something, so some problems could occur immediately or in the near future. So you should check your dentist about your wisdom teeth. If you have wisdom teeth, how are they positioned and what should you do about them in the future if it's necessary. So if you listen to the end of this video, you have all the information you need on how to approach your own wisdom teeth if you have them when you check at your dentist to see what should you do with them. Wisdom teeth, once erupted, do not move your other teeth. This is old school knowledge where older doctors thought that wisdom teeth, when once erupted, would move all your teeth because they had an idea, because at the same time your lower incisors, frontal incisors, started to compress themselves, and they thought that the wisdom teeth from the back pushed through the molars and everything and pushed the incisors. This is really illogical from this one simple fact that one tooth cannot push 7 other teeth. It's really simple as that. It's just forces applied. The orthodontist will tell you much better why this is happening, but frontal teeth compress in the lower front because something that it's called the anterotation of the mandible, but we will talk about it probably in some future video. Angulation comes the retention of those molars because the jaw has 2 major parts, the body and the ramus. And when we talk about the body and the ramus, when we talk about the body and the ramus, in between them there's a sort of angulation. They're often in an angle position. This part of the angulation is most often where the third molar erupts and can cause problems, even if he's angulated because he arose from this part, or there can be some sort of retention of food or crampedness, or it's cramped because the bone from the ramus is cramping the third molar to erupt properly, and the second molar which is located in the body of the mandible also shows some problem with it. There's also a lot of food retention between the second molar and the third wisdom molar, and also there can be some retention between the wisdom molar and the bone that is behind that third molar. So this is where problems start to occur. If the molar erupts partially but not completely, then it's partially covered with oral mucosa tissue. This is also called with a operculum. This is also called an operculum. I don't know how it's pronounced in your country, but operculum is just basically a soft tissue that is partially covered. It's partially covered the wisdom tooth. It's not erupted till the end, and the problem because of this operculum occurs that food and bacteria and everything can go inside beneath the operculum between the wisdom tooth, and then can retain and accumulate or in between the second molar and the third molar inside, or even worse sometimes, depending on the case, behind the third molar and the ramus of the body of the mandible. And this is when they say my wisdom tooth hurts, I got swollen because of the infection. This is over 90% of the cases the cause of the infection, because you have a retention space caused by food accumulation in an area. You have basically a pocket pocket of granulatic tissue that is formed because of operculum, because of the retention of the operculum and the partially erupted wisdom tooth, and it can cause severe damage. Sometimes it does not cause any type of inflammation, but cavities can form from the third molars, and then it's better to treat those molars with extraction, not to treat them, try to save them, unless that there's a function for the third molars, let's say for chewing, or if they have a molar on the other side, and you can use this lower molar to remove it. We are now talking about molars in the lower jaw most of the time, and we talked about the molars in the lower jaw. If for the upper jaw the thing is the same, but those molars usually erupt pretty well. Maybe some are formed a little bit too much to the cheeks and can sometimes cause pain and discomfort because of chewing, but if you do your hygiene properly and if they're placed properly in the mouth, usually it does not require to be removed. If they're if any other point of view are causing any damage to, let's say, your second molar, with eruption or with cavities because of food retention, then of course the wisdom tooth in the upper jaw should also be removed as well. When the tooth erupts, regarding any tooth in your mouth, it has a sort of a protective bubble, we can call it layman's terms, and this bubble, which is a part of the growth of the tooth itself, is using its metabolical function to grow through the bone, to dissolve the bone from one side and grow out, and then the tooth can erupt in the mouth. This happens with incisors, premolars, molars, canines, with every teeth. Also happens with third molars. But the point is, if the third molar gets in a tight spot and cannot come out, then a lot of times this bubble, we call it, forms and stays sometimes and can not erupt and can be formed as a dentogenes, as a follicular cyst. It's a follicle that which helps tooth eruption. But if it does not erupt and does not burst, then it can become a, let's say, a cyst, a follicular cyst, or any other type of pathological lesion if it goes over some genetical changes over time. So it is really wise, let's say, to check with your dentist often, to check out if your molars have erupted properly, so you can avoid any cyst formations in the future and have some major surgeries done because of that, because you did not check it on time. So when we balance off if the third molar are for removing or not, then we decide. So okay, we leave the molar, it's okay, but if the molar needs to be removed, there are several options we can do it. If it's erupted normally, without any problems, a normal extraction can be performed without any bone drilling or something like that. But if a alveotomia should be performed, which basically means the removal of alveolar bone around this third molar, so we can remove, as dentist surgeons can remove the molar with more ease to cause you less damage when removing the molar. The surgery takes place between 5 minutes sometimes, and sometimes if the molar is especially angulated or the position is hard, can take even more. When the patients ask me, "Doctor, how longer will this procedure last?" I've removed over 1,000 molars now in my period as a specialist, and I can tell you it can range from 5 to 50 minutes. Happens, you know. With more experience comes more idea that every single and simple case can be a problematic one, as a complicated case that you think it's complicated turns out to be very easy. So with modesty and with humbleness, you should approach, the doctor should approach every surgical procedure as such, and to have a careful examination how the thing can turn out, and treat it with the best intentions as possible. When you remove the tooth, usually it takes some suturing, some close-up of the wound. Some surgeons close the wound completely, some use it partially open, so that the hematoma that forms should be less and less and less. Pain is normally to occur depending on the situation that you were having, depending on the case you had in your mouth, the position, angulation, the molar, and the surgeon who's been operating on you. And it should also be the pain and the swelling go up till the second day, and they then drastically fall off. How to help to remove pain and reduce swelling and help up the speeding problem using some type of blood plasma products, which I particularly use. You should check my videos regarding that, which I will post soon. I hope you like this information, these topics. I hope you like this information and tips I gave you around your wisdom teeth. I hope you will assess your situation with care, as your dentist should. And if you like this video, hope you like and subscribe to my channel to see more future content regarding dental stuff. And I hope to see you soon. Bye.